We are here tonight with the folks of the Oaks at Paloma. Say it for me
La
again.
Paloma.
La Paloma. I'm sorry. Tongue twister there. And of course, we have Jeremy Pitzer. He's the CEO of the Oaks, and Dr. Lucas Trautman, a medical director out there as well.
Correct.
We are enjoying our conversation with you tonight. This has been going great. We've already had a call come in, and we actually have another one here on the line. Let's go ahead and get to it. All right. I believe this is Janet on line 1. Hi, Janet. What's your question tonight?
I would like to ask the experts, do they know there's a difference between addiction and dependency?
Great question. Thanks for calling in tonight, Janet. I'll let you guys address that.
Absolutely. Absolutely, Janet. That was a great question. Thank you. So dependency could happen with any medication or substance that you take every day, and your body relies on it and gets used to it, and when you come off of it, you need to taper off. Addiction is a much different process, can often involve physical dependence, but can include a lot of other behaviors and more psychological need for that substance as well. So absolutely, and I talk about that difference all the time. If someone relies on a medication that can cause physical dependence, I let them know that that's a lot different than being addicted to something.
You know, during the break we actually had another question too about, you know, say you had a bad experience prior to, you know, going somewhere, and what's your advice to that?
Well, don't give up. Never give up. There are a lot of really reputable and good providers out there, our network and others. So just never give up. And I would just ask, keep in mind that we don't always get it right. We're not perfect, and you know, anytime we don't get it right, we want to try to make it right. We want to apologize, and you know, but never give up and never let that impact your access to getting what you need. That's
right. If you ever have any questions or just want to have a conversation about receiving some sort of treatment for addiction or mental health conditions, you can always call Foundations Recovery Network. It's 24/7. I think that's so important to just keep saying throughout tonight's show. Also, again, want to remind you that there are some events coming up you need to know about. Innovations in Behavioral Healthcare Conference. That's coming up in August. Is that right? That's exciting to hear about.
Yes, it's here in Nashville in a brand new hotel downtown, and it's the speaker lineup is just tremendous. I mentioned our music therapist who's going to be presenting over one of the lunches, and yeah, it's really great. So that's targeted at professionals and people in the industry. And
wonderful. We've got the Heroes 6K Run Walk. That's going to be in Nolensville, and that's coming up in September. Let's hear a little bit about that.
We just had our Memphis Heroes 6K, and I can't say enough about it. The Hero 6K movement is really about breaking stigma, and this show is about breaking stigma. You know, just doing this and being here and talking about these issues, and they do a tremendous job partnering with the community. The event supports the community, and it's a really fun race. The extra kilometer really talks about the extra distance that our patients have to go to be okay, to be normal, and so it's an amazing thing. They do great work, and I'm a fan. So
wonderful. Let's go ahead and get to our next call. We have Morgan calling in tonight to OpenLine. Hi, Morgan. What's your question for us?
Well, my answer is, did they ever serve, and do they know what the government did to us?
All right, I'll let you guys address that. So.
Well, I would just say thank you for your service if you did serve. That needs to come out first. I did not. Most of my family has.
Likewise, my 3 of my grandparents and my dad and a lot of people were in the service. My grandmom, who's in Nashville, Rosemary Brunette, met her husband, my granddad Joe Brunette, during World War II in Virginia, and she was a nurse to troops coming home. And so we've got a good Navy story. People who serve are very close to my heart. And some of the things that people have gone through have been very tough in their service to our country, and we're certainly grateful.
Yes, definitely. Thank you for your service, Morgan, and thank you for watching tonight. It's great because, you know, you guys are joining us this evening. This is your show, and we just want people to get to know you, and you're really, we're happy that you've invited us into your homes this evening, because this is a topic that sometimes is hard to talk about, but needs to be talked about. You mentioned the word stigma a minute ago.
Yeah.
Let's go into that.
Well, it's so pervasive, and it's only as powerful as we let it be. And so a lot of it is our own fear of loss of status, or people knowing things about us, or not what we put out there on social media, but you know, the real stuff. And there's fear of just losing a job because I have to leave my job to go get treatment, and what if my boss finds out? And so a lot of it is fear-based and not even logical thinking. But some of it is just also society. We haven't put the emphasis in this type of treatment. It's a small percentage of the overall healthcare budget, but it has such a large impact on our society. And so just the more we talk about it, the more resources and energy and research that we put into it, it just continues to bring that down. And that's the whole point of the Heroes movement.
And there's an interesting part of stigma that exists within medicine. So if you use medications to treat addiction, historically that's been frowned upon by some groups. At the Oaks, we have such a strong therapy component. We're so firmly committed to that. But also we use evidence-based approaches for medications as well to assist in that treatment. I heard a TED talk that discussed the early treatment of childhood diabetes. So a child would have diabetes, go to the hospital, be put on a zero carbohydrate diet. When they got better, they'd get sent home with the instructions, because this is before insulin, so with the instructions to avoid sugar. And most of those kids died a couple months later. When insulin was discovered, it was a game changer in the treatment of these children. Now diabetic children live healthy, vibrant lives, and we rely so heavily on lifestyle and insulin to treat them. It's the same with medication-assisted treatment in addiction. There is a stigma if you go to the pharmacy, unfortunately, and you're picking up a medication that helps assist in your treatment. And so I'm so passionate about bridging the gap between the community of therapists and the community of doctors to work together to apply all treatment modalities for patients, as they did with diabetes treatment back in the day.
Well, so that's a great comparison, definitely.
Yeah.
I do believe we have our friend Janet. Yes, Janet on line 1. Hi, Janet. Calling back for part 2 of that question.
Yes,
Janet.
they didn't let me finish. President Trump, I love him, and he's so proud of this country. And he talked about the people that helped build this country. I'm a 65-year-old woman, and I helped put my 2 cents worth in. My body I'm 65. My body, I got hurt in 1990. It's deteriorating. And I was on pain medication. I live by myself. But I could take care of myself, my house, my animals. Do you understand, by them taking my medicine away from me, how much it's cost Medicare and how much it's destroyed my life? I bought my own house, and I don't think I'm going to get to keep it now.
All right.
Janet is bringing up such an important voice, because the history of pain treatment. So Janet, it sounds like she gave much of her life in service to others, and it sounds like she perhaps had a physical job that really caused damage to maybe her joints or something like that, causing chronic pain. 40 years ago, we didn't treat pain that much with opioids, but maybe 20 years ago the pendulum swung the other way, and we started treating. There was a pain scale when I was doing residency, and you treated everything with opioids. We didn't want to have a subjective experience of pain, and that was how we were trained. And so a lot of people, perhaps like Janet, got put on opioid pain medication. And then, of course, that brings with it its own challenges, dependence, and even death in some cases. So people were taken off of those medications that they had been legitimately treated with for a long time. And to fully understand, I think, what Janet may be going through, the opioid receptor in the brain, when you activate it, it lets more dopamine be produced. So if you, in the regulatory mechanism that tamps down that dopamine and causes our brains to be in balance is pushed down, and so dopamine goes, and dopamine makes us feel good. Yeah. So when you take away the opioids, that mechanism, the brakes of the dopamine are really strong. And so perhaps Janet, I don't know her, I've never treated her, but her brain may experience lower dopamine because she was on opioids for a long time, and the mechanism, the brakes are strong. And people who get pulled off of their medication abruptly can experience lots and lots of medical issues, because that's a medical situation when you take away your medication. So I can imagine how she suffered
Oh, definitely. We do appreciate you calling. Again, the number's right there on your screen. We want to hear from as many people that want to call in tonight. This is free advice from medical experts. Jeremy, Lucas, and I, we were talking before the show, just visiting, and you guys, I believe, said that just even this area specifically, really high problem with opioid addiction. And do you want to address that?
Sure. Geographically, this middle America, even extending to Appalachia up into Ohio.
Wow.
A lot of the towns that were big industry towns where the industry left, and there's a higher incidence in some of the rural counties of unemployment and poverty. We know that those were some of the counties and are some of the counties that are hit hardest by the opioid epidemic. And people are really suffering in some of these places, and there's everyone, I would imagine, has someone in their family that's affected. So I think that our viewers tonight, I'm so glad and honored to be here to get the word out to them that there are treatment places that are going to, even if they had a bad experience, that are going to treat them like the person that they are, meet them where they're at, and they shouldn't be afraid to come forward. They're people who care.
And that place is Foundations Recovery Network.
Oh, yeah.
That's what we're here tonight talking about.
Yes.
If you don't want to call in tonight, that's perfectly fine. They do have a number that's 24/7 you can reach out to anytime. Also go online. All you have to do is type in Foundations Recovery Network and you'll find exactly what you need, as well as the locations that you are both obviously working closely with CEO and medical director at. So we're so happy to have you here tonight, and thank you so much for those questions. We're going to get to more after this quick break, but keep it right here.